Hi everybody, it's Patricia Cleary again, and I'm here to talk to you about the W-9 process in healthcare. Typically, when you sign up with your Medicare program and you get your initial Medicare number that allows you to treat and administer care to Medicare beneficiaries, you have to enroll with Medicare. As part of the enrollment process with Medicare, they have you obviously fill out an entire credentialing form and packet, and then they have you produce a W-9. And that's so that if you see traditional Medicare members, you will go and receive your 1099 miscellaneous form from Medicare themselves, and they'll send it off to you based on the W-9 that you turned in. And it's the same when you sign up and you become an in-network provider for a health plan. You complete your credentialing package and you provide a W-9 to them, and at the end of the year, you will receive a 1099 miscellaneous. But that process is different for out-of-network providers. And out-of-network providers, if your health plan has out-of-network benefits and a provider sees you out-of-network, then he submits a claim to the insurance company, but there is no credentialing package and there is no W-9 on file. So the process that is required through the IRS and through Medicare is that the health plan sends out a letter requesting the W-9. And sometimes the provider sends that back and sometimes they don't. If they send it back, the requirement is that the health plan pay the out-of-network benefit and the provider gets a check. If a provider doesn't send back the W-9, the process is that the IRS demands the health plan withhold 24% for backup withholdings and the balance to the physician. And then the health plan is to take that 24%, and by the 15th of the following month, you're to do an PFTS to the IRS. You're supposed to indicate which provider, through the tax ID number that was listed on the claim form, is being credited with that 24% that you withheld. And then at the end of the year, that provider is credited that amount of money for tax withholdings towards whatever tax bill he may owe. So in the case of Mirra, who manages 5 health plans, and that would be Liberty Advantage, Secur, Solis, Ultimate, and Sonder, Mirra typically, if they didn't receive a W-9, denied the claim outright. And even if the provider then later submitted a W-9, they wouldn't go back and reprocess those claims if it was more than 65 days old. So not only are they permitting the health plan to keep the money, but you as a provider are not receiving the credit towards your tax liability at the end of the year. And that's a big problem for you because it was a clean claim and it should have been processed. There's a couple of things you need to do. Is you need to submit a letter back to the health plan and appeal all the claims you've ever been denied. And they need to not only pay the out-of-network benefit that you are due, but they need to pay it with interest. And if they're refusing, you should probably demand that they apply and send to the IRS the 24% requirement. The other thing you should maybe consider is filing a complaint with CMS, so that CMS is aware. So there's already been an ongoing list of complaints to CMS on this issue, and you should probably just go ahead and file the complaint that they didn't pay a clean claim and that they denied it and it was clean. They should have reimbursed either you or they should have reimbursed the IRS so that you get the tax credit. But the other thing you need to do is you need to notify the IRS, because the IRS then needs to understand that they were supposed to withhold taxes and that they kept the money. And so the health plan has an obligation to shore up and make that right. Those are some of the things that you need to consider. But again, if you are in one of those 5 health plans that Mirra managed, Solis, Sonder, Liberty, Ultimate, and Secur, and you were denied, your claim was denied, those are the steps that you probably need to take to make sure that your tax credit is credited if they're not going to pay you. Again, that's send a letter to the health plan and let them know that their denial of the W-9 is not permissible. It is nowhere within Medicare guidelines. In fact, it is an IRS stipulation on how they are to handle that. And then you need to notify CMS, and then your other option is to notify the IRS so that you get that tax credit. Those are some of the things that you need to be aware of and some of the things that you need to file to make sure that you either get paid or get tax credit. I'll talk to you again soon.